You bet. Have a good one.
David Zoltan's health and well-being depend entirely on expensive medication.
It's one of the scariest things in the world to live as a diabetic without insurance.
For 2 years, he was unemployed and had no health insurance at all.
I had to go to the emergency room just to get regular care, just to get my insulin, which of course I need to live.
Relief came when President Barack Obama signed his sweeping healthcare overhaul in March of 2010, and Zoltan could afford a new plan for high-risk patients with pre-existing conditions.
This was a lifeline.
But it's a lifeline that could soon be cut. Starting March 26th, Zoltan will watch the Supreme Court like never before, as the justices hear 3 days of oral arguments on the Affordable Care Act. The court will decide if Obama's plan to cover most of the nation's 50 million uninsured by 2014 is constitutional. Many Americans have already reaped some early benefits, but reviews have been mixed. The stopgap pre-existing condition plan still proved too expensive for Glenn Nishimura, a self-employed consultant who's been denied coverage for high blood pressure and blood sugar levels.
I'm trying to protect against heart attack or the catastrophic medical incident that can bankrupt me at any moment.
Only 50,000 people nationwide are participating, far fewer than had been hoped. But 2.5 million young adults, like law student Samantha Ames, are grateful for a provision that allows them to be on their parents' policies until the age of 26. The rule was a lucky break for Ames, who required surgery when she tripped over her dog and broke her ankle last April. She says her previous student insurance likely would not have covered the $30,000 bill.
There was this enormous feeling of relief and, just immense gratitude that I was able to get this when I was able to get this, and that it was all covered.
So far, the law has also eliminated lifetime limits on coverage, reduced some Medicare prescription drug costs, offered tax credits to small businesses to keep employees covered, and required some insurance plans to provide preventive care for free. In that same time, many Americans also saw modest premium hikes because of the law, and some layoffs were blamed on it. It's still 2 years until the real meat of the overhaul kicks in, including the individual mandate, which requires all Americans to be insured and helps pay the way for those who cannot afford it.
The Medicaid expansion, as well as the premium subsidies that will be available through the new state-based health insurance exchanges, don't go into effect until 2014. So that's where a lot of the dollars are.
The plan will cost about $1 trillion over 10 years and will be paid mostly through targeted taxes and Medicare reform. But it all hinges on the High Court, which will soon decide if the law, or at least parts of it, can move forward. If not, no one knows for sure what will happen to those like Zoltan, Ames, and others who have already been helped.